Talcott Parsons was a mid-century sociologist, best known for his contribution to structural functionalism. A large component of Parsons' work focuses on common universal social structures and their underlying functions. Today's video will explore his concept of the sick role. We will apply this theory to a true crime case, providing a contemporary example of Parsons' work. We will compare this to Robert Merton's theory of status and role sets, and further discuss the advantages and limitations of the sick role. According to Parsons, a sick person has two rights. They are not at fault for being sick, and they are excused from performing their usual everyday social roles. They also have two obligations. They must want to get well quickly, and they are expected to seek expert professional or medical assistance. The aforementioned obligations must be fulfilled in order for a sick individual to reintegrate into society, as illness is defined as a form of social deviance. The sick role can be applied to the Gypsy Blanchard case. Gypsy Rose Blanchard, daughter to Dee Dee Blanchard, was initially diagnosed with sleep apnea when she was a baby. By the time she was 8, she had leukemia and muscular dystrophy, restricting her to a wheelchair and feeding tube. An array of diseases, such as seizures, asthma, hearing impairments, and visual impairments followed. However, these were later revealed as fabricated by her mother. Subsequently, Gypsy's illness was declared a case of Munchausen by proxy. While her illness was fictitious, Gypsy's life replicated elements of Parsons' sick role. Due to her condition, Gypsy received support and compassion from wider society, resulting in lowered expectations and societal obligations. As a result, Gypsy's goal in life and sole responsibility was to get better and seek treatment, as opposed to recovering and further contributing to society. Dee Dee's societal role and expectations were also influenced by the sick role, demonstrating the impact of the sick role on caregivers. Unlike most members of society, Dee Dee was not expected to work. Instead, she received donations to care for herself and her daughter. Her goal as a member of society was therefore altered, with taking care of Gypsy being her primary responsibility. Evidently, the case of Gypsy provides an accurate representation of Parsons' sick role in reference to how illness changes societal expectations and responsibilities. Whilst it demonstrates how illness can impact one's life, Dee Dee's decision to voluntarily impose the sick role on her daughter highlights an alternative perspective. While Parsons deemed this role as deviant and undesirable, Dee Dee embraced the sick role as a way to gain status. This was not an aspect considered by Parsons. The sick role can be compared to Merton's status and role set theory. Merton states that people occupy a particular social status, and that within that status, they hold a set of roles. Dee Dee's statuses include being a mother and a caretaker. Her roles consist of providing care, shelter, affection, and assistance to her sick daughter. Gypsy can also be prescribed roles based on Merton's theory. Her status as a patient aligns with her primary role, where she must accept care, compassion, and treatment from others. This complements Parsons' theory, whereby Gypsy is exempt from normal social roles to fulfill her right as a sick individual. Evidently, the two theories can separately be applied to the case. However, they come into conflict with each other. Parsons states that Gypsy has a responsibility as a patient to try to heal or seek medical attention. But Merton's role theory prevents this. The responsibility falls on Dee Dee instead, whose status is primary caretaker. Hence, while Merton's theory can be easily applied to this case, Parsons' theory requires some adjustments. The sick role is an excellent theory to explain general disease and how members of a society behave in the face of short-term illness. However, it did not truly apply to Gypsy's case because her illnesses were chronic and terminal. She would never fully recover, and hence would never fulfill her obligations to reintegrate into society. Other criticisms of the sick role include that it does not account for the emergence of preventative care, middle-class values that place work as a priority over health, or degenerative disease in which the level of social performance pre-sickness can no longer be maintained even after recovery. Nevertheless, Parsons' theory has been invaluable in understanding the patient experience and provides a foundation for medical sociology and current healthcare patient interactions.